It was a strange and frightening turn of events. A DeKalb County mom, always on the go, suddenly started getting dizzy and blacking out.
At first, Sarah Mason thought that she might be tired. She was going through physical therapy for a rear-end car accident, but there was much more to it than that. The Fox Medical Team's Beth Galvin joins us now to explain. Beth?
And Sine and Tom, Mason went in for a series of medical tests, and that's when they did an echocardiogram, and they saw this behind me, a huge tumor moving around inside her heart, and it was cutting off the blood flow, not allowing it to pass through her heart. But now they had to figure out how they were going to get this thing out of her heart. Sarah Mason begins her mornings early as she and her husband and girls get ready for school and the day ahead. And the 41-year-old Lithonia legal assistant says she's finally feeling like herself again after a frightening few months when she says she just couldn't seem to catch her breath.
Whenever I walk up the steps or moving pretty quickly, I started to feel really tired.
Then in May, walking into work, Mason fainted. And a few days later, after nearly blacking out again, she went to the doctor.
And so while I'm lying on the table, I see this huge mass. It looks like a kidney bean.
That kidney bean was a myxoma, or a benign heart tumor nearly 3 inches long, attached to the wall separating the upper chambers of Mason's heart.
All the blood in the body has to go through this pathway right here. And this large tumor is just basically blocking that valve.
Within hours, Mason found herself here at Emory St. Joseph's Hospital, meeting with Chief of Cardiac Surgery, Dr. Douglas Murphy. He says heart tumors like hers are rare. Most people don't even know they have one until a piece of it breaks off and causes a stroke. Hers was stable, but it was huge.
It's so big that if she would stand up quickly or get a little dehydrated, the thing would literally block blood flow and she would collapse.
Dr. Murphy specializes in robotic heart surgery, and he felt Mason was a good candidate. So instead of having to open her up, he made 5 small holes on the right side of her chest and placed her heart on a bypass machine for the most critical 15 minutes of the 3-hour surgery.
So we use the heart-lung machine and we actually rest the heart so we can go inside and see perfectly where the attachment is, make sure we get the entire tumor, no pieces left behind. The key to taking this tumor out is you take the tumor and just a small bit of normal heart tissue with it, so that way the tumor doesn't recur.
And once that heart tumor was out, Mason's blood pressure normalized, and very quickly she started to feel better.
For me, that was my test. I walked up the steps and I didn't have that fluttering. My heart didn't flutter.
No more dizziness, no more fainting.
This is my norm, and so now I'm back here in my norm. So I'm very thankful.
And Dr. Murphy and his team at Emory St. Joseph's have removed about 200 of these benign heart tumors. He says robotic heart surgery allows the patient to recover more quickly than traditional open heart surgery, but he says it can also mean fewer complications for the patients, like Miss Mason.
So they've done hundreds of these tumors, but not one the size of what we just saw.
No, I don't think
imagine.
anybody had seen one quite the size, 3 inches, nearly 3 inches wide.
And we're just in awe here, sitting watching this technology in
action. I know,
action.
it has to be really something for her to see it, you know, what was inside her. That's incredible.
Amazing.
Yeah, thank goodness that they were able to get it. Thanks, Beth.
Thank you, Beth.